Welcome back to the Founder Series, where we get real about what it takes to navigate midlife, grow through change, and challenge the systems that are supposed to care for us. I'm Dr. Rebbecca Hertel, and today's episode is one I feel deeply passionate about because it impacts not just my patients, but women everywhere in midlife. We're talking about insurance infringement, medical gaslighting, and how concierge care can change the game. So let's dive in. All right, everyone. This past week, I had one of those moments that stopped me in my tracks when a patient of mine who has obesity, hyperlipidemia, hypertension, and sleep apnea, and let me backtrack, meets the requirements for a GLP-1. It is FDA approved for obstructive sleep apnea that is secondary to obesity, and they were denied their GLP-1 by their insurance provider. Denied. Like I said, despite the fact that her medical profile makes her an ideal candidate, it is FDA approved. Zepbound itself is FDA approved for the treatment of obesity, or excuse me, obstructive sleep apnea secondary to obesity. But not only that, it's approved for weight loss with a BMI. And in those that don't have a BMI that's high enough, then we take a lower BMI and we add on what we call comorbidities. So hypertension, hyperlipidemia, obstructive sleep apnea, like I said. So when I talk about insurance infringement, this is when people writing the policies, not the people providing care, decide what treatments are appropriate. It's infuriating, it's maddening, it's frustrating, both as the clinician and as the patient. So, and it's not just GLPs, right? So I see this every day with women in midlife. So instead of proper hormone evaluation, they're told by their other clinicians just to lose weight, get more sleep, try a restrictive diet. All of that is called medical gaslighting. Just have a glass of wine and you're going to want to sleep with your spouse. Maybe if you did change the way that you dress and lose some weight, that maybe your spouse would want you more. That is medical gaslighting. So when you're dismissing symptoms and offering generic, even harmful advice instead of real care, and you're also giving your own bias as well. So that's huge. And we see it all the time. Like, I don't believe in hormone therapy. You should only stay on it for a year. You have to stop it at like age 55. I mean, so when they're just like putting out their own bias and not using any data to guide your care and guide the recommendations that they're giving you. That's an issue. And so, as a founder and a physician, I feel the tension of working in a system that often prioritizes cost saving over patient well being. But I also feel the responsibility and the opportunity to create a new way forward. There are, I'm sure, so many stories that you all have. And listen, you should DM me all your crazy stories and message me about them as well. Leave comments about the crazy things that you've been told, because every day women are telling me their stories about why insurance didn't cover this or that. I've had patients who I've tried to give different types of hormone therapy to, and it's not covered because they have to try a different type of hormone therapy that is completely contraindicated for them. This happens on the daily, whether it's insurance or it's another clinician that's telling them what they're doing is wrong, and then they come back to you and are like, well, they told me I shouldn't have to do this. They told me that this was not correct. They told me I can't take vaginal estrogen with my systemic estrogen. And then you have to re-explain yourself. I had same thing with breast cancer history, family history of breast cancer. You go through all of the information, all of the statistics, all of the data, and then they go and see their high risk breast practitioner. And they're like, well, I wouldn't do it if I were you. You are not supposed to say that. And definitely not in that way. So now I've got to backtrack again and say, this is not correct. A family history of breast cancer. You may or may not have a risk. You have a genetic predisposition. Did we do some genetics? Are you at a higher risk? You still ovulate and no one took out your ovaries. You had higher estradiol at certain times of every single month than I would ever give you. And so it's a whole thing that we hear. Obesity is another one. How about you just like stop eating and start exercising more? If I had a like penny for every time I would hear that, like that is not the way it works. Because a lot of my patients that suffer from obesity actually are undernourished. So there's that. Okay, I'm not going to get on my soapbox about that one. Before we move on, the other thing I also wanted to remind everyone about is that although you meet criteria for a medication, if your insurance doesn't cover it, your insurance doesn't cover it. Okay, so I get it all the time, but I mean, I know you do. I know you meet criteria. I know your BMI is over 30, or I know your BMI is over 27 with a comorbidity such as hypertension, type 2 diabetes, dyslipidemia, obstructive sleep apnea, or cardiovascular disease. But if your insurance company doesn't cover weight loss medications, it doesn't cover weight loss medications, and more and more and more and more are not, because the cost of them is so expensive. All right, so let's talk about what the new way can look like. In today's Midlife Minute, I want to share how concierge medicine can help work around these barriers and give patients the care that they deserve. Concierge medicine is not about luxury, it's about access. And that's what I love about it. It's a model that allows me, as your physician, to spend more time with you, to actually listen and to make decisions based on clinical need. We actually work together as a team. And let me tell you, some patients really struggle with this. They just want me to tell them what to do, but that is not what we do. It is a collaboration. We are a team. We work together. I am going to take your ideas. I'm going to give you my ideas, but ultimately, together, we're going to make decisions. And it is so much more fun to be like, listen, we can do this, we can do this, and we can do this. And neither one of those things are wrong. What do you think? Because you may have a different idea than I am. Maybe you want to try adjusting your progesterone before you would adjust your estradiol, right? I do this all the time. So this also keeps the insurance company out of what we decide to do together. So here's what it means in practice. A lot of times there's no prior authorizations holding up treatment. Now, I will say to you that if there are certain types of medications that we are going to use your insurance for, I may still have to do a prior auth. It isn't really that difficult through like Cover My Meds and things like that. It really isn't. And I'll say that, like, listen, here are some other options. If we want your insurance to cover it, there may still be a prior auth. So it doesn't take it completely away necessarily, but for covering my care and my time for you, I don't have to do any of that. It's more so if we're still going to use your insurance for labs or testing or certain medications, we could still fall into that issue. But there's a lot of other pathways. So it also gives the freedom to prescribe what works, right? So whether that's a GLP-1, hormone therapy, PET therapy, hormone optimization therapy, right? Or other evidence-based options, because we've got some different avenues also that we can use in order to access medications and labs. This is more proactive care. Instead of waiting until things get worse, we focus on prevention, longevity, your health, early intervention. So that way we are focused more on your health and not chasing something that's already come about. We want to prevent it from happening. So concierge care can help cut through the noise of insurance restrictions and puts the focus back on where it belongs, on the patient. And allows us just to spend that time back and forth, and we're not rushed. So if you've ever felt dismissed, delayed, or gaslight by traditional medicine, this is an option that can change your experience of care. Really what it is, and as a matter of fact, it's funny because one way to think about it, I was actually having a conversation with my husband. At one point, it seems to make more sense to just buy catastrophic insurance and put all the money that we pay toward our premiums into a high yield savings account. And then you pay cash for your labs, your imaging, and your medications, because right now I can get all of those things at a less expensive rate than what my insurance covers. The insurance that I have at this current time just doesn't make any sense. Like, for instance, my son had pneumonia and his x-ray cost me $400 with insurance, and I have the best insurance that is offered that I can get. And I could have went somewhere else and paid cash for it for $99. I wasn't even aware of that until I started doing more concierge care and really talking with patients that don't have insurance. They choose not to have insurance, or it's too expensive for them to even get it. I mean, there's so many other options. And there's so many other options just within my own practice where I can order labs through different services that are a quarter of the cost, a fraction of the cost of what you would pay for with your insurance plan. I mean, it's absolutely absurd how things are marked up and written up. The same thing with like again, a bone density. You can go pay out of pocket for a bone density, maybe around $100. In some places you can get it for $50. CAT scans, MRIs, a mammogram if you go pay for it. I mean, there's just so many things now. It could be a little bit more difficult in this smaller city, whereas like in larger cities, I think the access is quite a bit better. But there are options. There are options for medications as well. There are options for using coupons and to pay out of pocket for your medications because it's just less expensive to do it that way. Or maybe you don't have coverage for your medications. One thing I want you all to think about too is that if you have clinicians that are in the insurance-based model, remember how many patients they're seeing a day. So they may really not understand or know the ins and outs of where you could get different care, less expensive medications, less expensive labs, less expensive imaging. But you certainly can reach out. Ask the question. Ask them first, because you might have a really great relationship with them. If they don't, though, you can reach out to, concierge practices and ask. And that is the caveat to, a direct primary care or a concierge practice where we have learned all of those different pathways because we see you know, we see a lot of patients that are used to paying cash for whatever healthcare that they need. And there's a lot of care that is getting rid of the insurance-based model. Physical therapists, they're out of network, because reimbursement is terrible. Same thing with your mental health as well. So this is not new. And we may be seeing more and more of this because insurance companies are not doing justice to our patients, and they're certainly not doing justice to the clinicians. All right, let's head over to the Labby Lab, and let's start with the truth. And the truth is, these systemic problems aren't just frustrating, they're expensive, which brings us to today's In the Labs. So let's look at the numbers and what they're showing about medical costs in 2024. So let's stop for a minute and just really take a look at what's kind of been going on recently. So here's what the research is showing, and it is eye-opening. So nearly half of the US adults, about 44%, report that it's difficult to afford healthcare costs. 23% say they or someone in their household had trouble paying for their care in the past 12 months. Not only that, but between 12% of US adults, about 31 million people, had to borrow money last year to pay medical bills, totaling an estimated $74 billion. Guys, this is an issue. This is an issue. And so meanwhile, a remarkable 45% of American adults now report that they're either cost insecure or cost desperate, meaning they struggle to pay or unable to cover medical bills. These aren't just numbers, they're real human experiences, with nearly half the population's worries about affording care and millions borrow to get it. The system is failing us, and these challenges disproportionately impact women in midlife, Black and Hispanic communities, and those with lower incomes. All right, so in closing, that's today's episode. Insurance infringement and medical gaslighting are real, and they're harming patients every single day. But there are alternatives. By reimagining how we deliver care, we can create a future where midlife women are seen, heard, and treated with the respect they deserve. So if this conversation resonated with you, please share it with a friend who's felt dismissed or denied by the system. And as always, remember, you deserve care that actually cares. Thank you for spending time with me, and I'll see you next week. Remember to like, review, share, follow on all the platforms. All right, y'all. Take care.